chairing the webinar today, and I'm joined by a fantastic panel, all of which are going to introduce themselves very shortly. The topic for today's webinar is all about navigating the NHS and navigating the West Yorkshire health ecosystem, and that notion that there's lots of assets out there across the West Yorkshire region, all of whom want to collaborate, want to work together and support companies like yourselves to access the NHS and to gain that market adoption. So again, huge thank you to everybody for joining us today. This is the third webinar in a 10-part series we've been running. And all of the webinars so far have kind of offered insights, advice and guidance to SMEs like yourself. The webinars have been delivered in partnership between Health Innovation Yorkshire and Humber, and have been delivered as part of the Innovate UK West Yorkshire Health Technologies Launchpad programme. And they really are designed for any innovator, regardless of whether you come from industry, from the health and care sector, whether you come from VCSE, academia, no matter. It's all about offering insights, advice and guidance to help you accelerate your journey to market. And, as much as we are focusing on West Yorkshire health and care system, the ecosystem, the assets in the region, and we know there's lots of companies from within the region on the call today, we really hope that there's others from across the region, nationally, maybe even internationally, who are listening in today, keen to work with the region, keen to understand what's out there. So I mentioned I'm from Health Innovation Yorkshire and Humber. My role is predominantly working with companies like yourselves and supporting them to access that route to market. I mentioned about Health Innovation Yorkshire and Humber. We really are the innovation adoption arm of the NHS, set up back in 2013 to work at that interface between the health and care system, understanding needs, demands, priorities, and then to work with industry to understand what that pipeline of cutting edge innovation is. And, we work with companies on a daily basis, offering that advice and guidance. And the webinar in partnership with the West Yorkshire Launchpad that we're running today is very much an example of the sort of work that we do. So just before we kick off into the main webinar, a couple of bits of housekeeping from me. So the webinar today has been recorded, and the recording will be shared with all registered attendees after the final webinar in the 10-part series. If you've got a question, please do raise it in the chat function, and I'd encourage you to raise it as soon as you have that question, so don't wait until the end when all the panelists have spoken. The agenda for today, I'll pass over to the panelists to introduce themselves very shortly. We'll then take some pre-moderated panel questions, and we'll then move into audience questions. But if we've got lots and lots of questions from the audience which are in the chat, I will very much skip straight into those after the panelists have introduced themselves. So the more questions are in the chat, the more time you've got to ask your questions and engage with the panel. And then secondly, if you do want to ask questions directly instead of putting them in the chat, please raise your hand during the audience Q&A section, and we'll very happily unmute your mic, subject to the tech working okay, and you can have a chat with the panel directly. So I think that's it from me. I'd like to hand over to my fantastic panel today to introduce themselves, tell a little bit about themselves, their roles, the work they do, and importantly, how they work with innovators like yourself. So Lawrence, are you okay to introduce yourself first, please?
Yeah, sure. Thanks, Sean. Hello everyone. I'm Lawrence Glenolty. So I'm a senior program manager with the National Institute for Health and Social Care Research in the I4I program, so the Invention for Innovation program. So I joined the program a little over a year now. Before that, I was working at a university and a trust, helping them apply for funding in their innovations, supporting product development and doing general business development for them. And since then, I've transitioned to NIHR and sitting on the other side of the funding, which is quite interesting for me, but I've seen sort of both sides of the funding pathway from that. The NIHR itself, you might be familiar with, so we're one of the largest funders of health and social care research in Europe. It's about 1.4 billion a year budget. About half of that goes towards infrastructure, so we do a lot in the NHS research infrastructure, funding the research delivery network, fund a lot of centres of excellence, such as the HealthTech research centres and biomedical research centres. In Yorkshire and Humber, we've got 3 HealthTech research centres, which are particularly relevant today. These are centres that are designed to help you develop your innovation, deliver the appropriate research to evidence it properly for ultimate use in the NHS. So I would very much encourage you to reach out to these centres to help you in your journey. I think we've got their theme centres, and we have one in Leeds, which is in surgical care, I believe, and then there's two in Sheffield, which is one in paediatrics, and the other is in long-term conditions. But there's 14 centres across England, and you're welcome to reach out to the most relevant one for yourselves. So yeah, that's me. I think as the NHR, the I5 programme has funded a number of projects in the area. We've funded about 19 projects, 11.5 million in the last 5 years. Several of these projects are led by companies, so our funding pots can be applied to by SMEs or NHS organisations or higher education institutions. And we like this to be a collaboration. We have a number of funding streams that you can look for online. But the flagship program is our Product Development Award. So this will fund you from proof of concept all the way through to implementation of your innovation. And we ask, so the requirements for this is that it needs to be a collaboration. So we recognise that different expertise are needed to progress these products from ideas to market. And so it needs to be a collaboration between two eligible organisations there, and awards go up to 3 years and between 1 and 2 million on average. But I will leave it there for my intro and hand on to the next panel member.
Fantastic. Thank you very much, Lawrence. Adele, could you go next, please?
Yeah, sure. Thanks, Sean. Hi, everyone. I'm Adele Bunch. I'm Head of Portfolio for Health Inequalities, Mental Health and Patient Involvement at Health Innovation Yorkshire and Humber. Lovely to be with you all today. So as Sean alluded to, we are one of 15 health innovation networks, and we bridge innovation with health and care. We work nationally on behalf of NHS England and the Office of Life Sciences to both scale proven technologies at pace and wider tech. So here in Yorkshire and Humber, our CLG arm of the business works on behalf of and with a range of commissioners and stakeholders, including the CQC and the Health Foundation. Our mission is to transform lives through innovation, and we have a very strong focus on improving the health and prosperity of our region. So our priorities, if you like, include improving population health and reducing health inequalities. We've got a focus around enhancing NHS productivity, workforce resilience and new care models, driving economic growth through strategic partnerships, championing digital health innovation and patient involvement, all underpinned with a focus on sustainable solutions and net zero ambitions. Our engagement with innovators, academia and commissioners in industry is very vast, including with those who form part of the HealthTech cluster in West Yorkshire. Adam, our co-panelist, who will introduce himself shortly, he leads our MedTech funding mandate policy, and he engages with the system, patients and innovators, Innovator Apos Health to scale the adoption of their trainer, which is designed to improve symptoms of knee osteoarthritis and delay surgery. So myself and the team, we regularly meet with innovators in our pipeline to understand their innovation, identify opportunities in the system, and where possible, locate funding to test and deploy those solutions. Specific to health inequalities, I chair a bi-monthly population health roundtable with ICB leads, local authority, and our hub colleagues, and that's been a really good vehicle for highlighting innovation. We also, as a network, co-lead a quarterly health literacy community of practice with Health Innovation NENC, North East North Cumbria, and together we showcase literacy innovators to a network of about 350 stakeholders. And then just quickly, some recent successes where we have bridged innovation include the pilot of FSIM, which is an ADHD diagnosis and support tool, where we worked with Vision and secured 8 schools in Humber and North Yorkshire to test that intervention with their young students. We've worked with Motion Health, helping to secure Launchpad funding, where we're currently supporting their patient involvement activity in a care home project. And finally, we've secured some SBRI funding jointly with Wellmind Health, again supporting their patient engagement element for inclusive and authentic co-design of a digital mental health programme. I've been with the network for about 3 years now. Initially came in to do a piece of work around CBD and inclisiran, and then for the last 3 years, I've been doing this role as head of portfolio. But lovely to meet you all today, and I hope we can do some work together in the future. Thanks, Sean.
Thanks very much, Adele. Steve, could I come to you next, please?
Sure. Hi. Is my mic working? We're all good?
Yep, all good,
Okay,
Steve.
great. My name's Steve. I'm the CEO and co-founder of a company called PocDoc. I feel really passionately about what we do in the area of cardiovascular disease prevention because when I was 14 and my dad was basically the same age that I am now, almost to the day, he had a huge stroke due to undiagnosed cardiovascular disease. We've set out on a mission to combine rapid diagnostics with applied cloud-based AI to reduce the time from screening to treatment to minutes, not weeks or months or never, under the existing system, under the existing standard of care, focused on cardiovascular disease initially, but then also prevention of type 2 diabetes and chronic kidney disease. So our flagship product is called the Healthy Heart Check. It delivers the equivalent of the NHS Health Check in just 9 minutes using a smartphone and one of our rapid test kits. It integrates back up with the NHS risk engine. It integrates the results with the patient record. We're now the #1 generator of QRisk-3 scores outside of a GP surgery in the UK. And our NHS evidence is really compelling around reduction of health inequalities, of driving an increase in lipid lowering therapies, particularly in communities, workplaces and homes. And we've been really lucky to work with Health Innovation Yorkshire and Humber and the NHS West Yorkshire and a few others, but particularly West Yorkshire has been a real support for us in helping us get those early phase 0, phase 1 projects in the communities and in workplaces, as well as doing some homes that have then led on to us being able to work with the local system off the back of actually having real local data that's generated. So we're hugely appreciative of the Health Innovation Network nationally, but particularly in this area. So it's really great to be here. In addition to doing PocDoc, I also host a podcast called the HealthTech Hour, where if you're interested in health tech and founders and hearing stories and journeys of people going through health tech, we've had some incredible people on that one. And then finally, I also run something called the Last Friday Club, where on the last Friday of every month, I give up my time just to deal with any problems that you might have. So you can book a session with me. No agenda. I don't want to get paid. I don't want to be on your board. I don't want any stock. It's just trying to help the ecosystem. And if I don't really know the answer or don't have anything, I can probably find someone that can. So that's me. And you can contact me here or you can find me on LinkedIn and we can chat.
Brilliant. Thanks so much, Steve. I'm sure your LinkedIn inbox will be exploding with requests and asks as we speak. So thanks very much for that. Adam, I'll come to you next, please.
Hi, everybody. Nice to be here today with you all. My name is Adam Smith. I'm a project manager and I lead on the MedTech funding mandate work that Adele alluded to earlier for Yorkshire and Humber. And I'm also on the patient involvement and engagement team. So the MedTech funding mandate, it's a NHS England policy which seeks to reduce health inequalities by improving access to a series of nice approved innovations that have been deemed clinically effective, cost of saving and affordable to the NHS. I predominantly work with our Yorkshire and Humber acute trusts, ICB leads across our 3 ICB areas, the innovators themselves of the 12 medtech innovations that are currently sat on the policy, the NHS England team, Office of Life Sciences, patients and carers, and my equivalent leads across the 14 other health innovation networks nationally. We sit as honest brokers in those conversations between innovators, product suppliers and the NHS teams. My focus and what's always kind of driving me in our work to support that is development of business cases to introduce these innovations. So we support the evidence creation approach, like forecasted benefits, what impacts are expected through adopting the innovation, and how those benefits are going to be realised and measured, and the quality assurance to ensure sustainability going forward. We do a lot to raise awareness of the policy and the products within it, within our local systems, and we share best practice in implementation, not just in the region, but externally as well. We link up nationally as well through our health innovation networks, which is really important, and that helps us capture barriers and challenges to adopting innovation. And 15 heads are better than one in that case. So that's a bit of insight as to what I do in my role. I've been in the Health Innovation Network in Yorkshire and Humber now for about 3 years, similar to Adele. Before that, I was 15 years civil servant in the Home Office, doing a whole wide range of roles through operations and training, assurance, risk, through to projects, which kind of led me to the health service, which is a very different playground, but similar challenges and similar barriers to overcome. But that's me. Thank you.
Lovely. Thanks very much, Adam. And last but not least, I'm going to pass over to you, Richard. I think you've got a couple of slides to introduce yourself with.
Great. Thank you, Sean. Good afternoon, everybody. It's really great to be here on this Series 3. My name is Richard Hall from a company called PDM. PDM is from industry. We are a design, innovation and sustainability consultancy. We've been around 20 years, and in that time we've seen some quite transformational change in the healthcare industry. The reason for this slide is to explain what we do. So thinking and doing, or strategy and implementation. So innovation starts with a conversation, and it's really important to get user insight, patient engagement from the outset, and kind of build your innovation from a very stable platform, as opposed to having a bias about your technology and thinking that it will be adopted. So we're the guys that navigate clients through that tricky innovation journey. That can be a high growth startup, it can be an SME, it can be a manufacturer, it can be a university, or it can be big medtech. So our two biggest clients are 32 billion US kind of turnover, and we're only a small consultancy ourselves. So the thinking aspect is that horizon scanning, tech scouting, thought leadership, knowledge transfer, and the doing, as well as the strategy and thinking, we do the doing and implementation. So it's things like design sprints, prototyping, manufacture, engineering, focus groups to validate that early stage kind of thinking. Next slide, please. I did want to say that, but I'm going to say it. Next slide, please. A big aspect for us is sustainability. We started in sustainability about 10 years ago. And being a design consultancy, sustainability is embedded at the very start of that process, whether it's a product or a service. About 80% of the innovation is embedded at the sustainability at the very start. This slide shows the different aspects in terms of the things that you need to think about as you're innovating. So scope 1, 2 and 3. Scope 1 and 2 is effectively, if you imagine it as buy and burn, and scope 3 is the actual product. A few years ago, about 4 or 5 years ago, the NHS created its white paper, which is all about net zero 2045, about how the healthcare community will decarbonise through products and services. And you will start to see this to become amplified over things like the NIHR I4IPDA, SBRI and Innovate UK, where you'll be asked very explicit questions in terms of how will your innovation, product or service align with the NHS requirements. It's not just an NHS thing. The NHS net zero is being adopted by all the healthcare systems across the world. So it's something that you need to think about in terms of embedding sustainability from the outset. It's quite a complex subject matter. So we are spending a lot of time helping organisations to understand what it means, but also how they actually address it. So we're doing some stuff with the NIHR later in this year, running some workshops. We've done some carbon literacy programs with the University of Leeds and Innovation Pop-Up. So we've got lots of initiatives going on within West Yorkshire where we can help you to understand what you need to do in terms of that decarbonisation piece. So yeah, I'm really looking forward to this webinar and adding some value to it. Thank you.
Lovely, thanks so much, Richard. And again, a huge thanks to our panel today. I'm sure you'll all agree, absolutely fantastic lineup of panelists with some really, really valuable insights, which I'm really looking forward to starting to share a little bit more over the remaining time of the webinar. So I wonder if we could just open with a question to a couple of our panelists. And I think perhaps, Steve, I'll come to you first and then over to you, Richard. I'm really interested to understand from your perspective as a company working in the system, working in the region, and Richard, yourself, an organisation that supports businesses. What do you see as kind of the big trends, the big opportunities at the minute for innovators? And I guess, innovators who are based in West Yorkshire, working in West Yorkshire, but also nationally. What do you see is happening out there at the minute?
Well, again, first of all, it's great to be here. I'm happy to take on this question first time. The first thing that we did, and I'm not just saying this because it's their webinar, but we did actually engage with everyone in the Health Innovation Network as a first step across the country. And some were more helpful, it's probably you can draw some inferences about the webinar that I'm on about who might have been more helpful. And there were other people that were, less helpful, I guess. But those networks are actually now really dialed into the local system priorities. So they are not just acting as a trusted broker, but they're actually almost like translating, we found, the system priorities into the innovators locally or nationally to try and help innovators locally and nationally build solutions or adapt solutions, amend solutions, package solutions, price solutions, such that they could be adopted by the local system. So we actually over-indexed in engaging with health innovation networks to try and get them to help us take the technology that we were developing and had developed and understand with them what needs and problems it could solve in the local areas and what changes, if any, we might need to make to any different element of it for that to be successful. So the NHS doesn't make a secret. This is my experience, and sometimes I get yelled at about saying this stuff, so I apologize. But the NHS doesn't make any secret about what its problems are, right? Where it needs help with. There is a steady stream of white papers, a steady stream of priorities. Sometimes they change. Every local ICB has its own roadmap that it's working to. The Health Innovation Networks publish things. The grant funding bodies publish challenges. This is not like it's not like a black box, right? So there's an element on an innovator or a business person that to understand what's already being talked about. There's no secret, right? Workforce is a massive one. The major prevention of the major diseases is a huge one. Moving any type of care or provision of care out of a GP surgery is a massive one. Anything to do with waiting list backlogs is a massive one. So if you're in and around those areas, you're in the right area. But there's still a huge amount of work to do to take that sort of generic statement and craft it into a proposition that a local system can acquire, procure that good or service. And that's actually where we found the Health Innovation Networks, particularly Yorkshire and Humber, to be really helpful, actually. So you could be in the right area, you can be in the right ballpark, but actually then to torture the metaphor, getting it onto the pitch and scoring, actually, you need some help to do that.
Great. Shall I follow on from that, Sean?
Yeah, please do. Thanks, Steve.
Yeah, that was really interesting, Steve. I think for us, the key phrase there, Sean, was trend. I think I will talk about sustainable innovation. So the way that we frame this is that, the health tech industry has been through various crises over the years. So, recessions, COVID, MDD to MDR, and all of these are kind of transient. They're things that the health tech community has just got to get through. And I think in terms of a trend, my concern is that organisations see sustainability as another thing they've got to deal with, adding it to the list. But the reality is that you need to embed sustainable innovation from the outset, Otherwise, you will get caught out and you will not be able to get onto the procurement framework. So I think it's something that people need to really take notice of. I mean, what normally happens is the sustainability lead within an organisation is usually the QARA person or the person that wasn't in the room when they were kind of voted. And it sounds like a bit of a joke, but it's not really funny, because I think that it's really starting to amplify. And I think my comment would be, don't look at sustainability in terms of it being a trend. It's really something you've got to embed from the outset, and it does require a certain set of skills to really understand what that's about.
Lovely, thanks very much, folks.
But hold up, can I just jump in on that one though, Richard? What's your view though on whether the system is willing to pay more for a product that is sustainable versus one that is not, in any kind of procurement where pricing is weighted so heavily, scoring is weighted so heavily in favour of pricing?
Very good question. And I'm in Newcastle, and I was asked that question about 2 hours ago on a panel session here. The reality is that the NHS has created its 2045 roadmap, and Department of Health and Social Care created its Design for Life in terms of the need for leadership. So on the outside, the NHS is talking about decarbonising, and when we challenge the NHS in terms of a carbon cost, so if you were to onshore a physical product, for example, whilst the cost of that product might be more than offshore, the carbon cost is less. And I think it depends which trust you talk to within the UK as to what that answer is. So in some cases, some trusts aren't really interested. It's all about cost. But some other trusts are really interested in it, and within their internal politics, they're trying to turn it. So there is no, if you are to decarbonise, it doesn't necessarily mean it's going to open up the doors, but the reality is you will not get onto the procurement framework without answering those questions and having a carbon reduction plan and a product carbon footprint. So I totally understand where you're coming from, Steve, on this.
No. I think it's because I sit on the NHS England SME advisory board, and it's a big issue for SMEs. But I think the way you phrased it there makes a lot of sense, which is there are some basic things every company has to do now, right, to fulfill certain criteria, and then it will depend upon how this whole area develops system by system as to what emphasis they place on it in any future procurement. But there's no avoiding the requirement to do the basics. And what you're saying, it sounds like, is if you think about that in advance when you're developing or amending or launching, it's easier than trying to retrofit it.
And I'll let you into a secret, Steve, and all the people on this webinar. I think sustainability is misunderstood. So if I reframe sustainability in terms of operational efficiency, so your product or service, if you think about it in terms of decarbonising by being more efficient, so if you reduce your cost, you can reduce your carbon, and therefore you can increase your profitability. So when we talk about sustainability with CFOs, for example, we are actually talking about operational efficiency. They're very, very closely aligned, and this is what people need to kind of think about. You can actually be sustainable and reduce your costs and increase profitability.
Thanks very much, Richard, and thanks, Steve. I think both of you touched on in what you were saying there some really, really good examples of some of the challenges that SMEs have in navigating that kind of route to market within the NHS. We could spend, the next 2-3 hours running a webinar on those challenges, those barriers, and how to overcome them. But I just want to pick on a couple of topics and just kind of explore them in a little bit more detail. I think one of the topics I'd like to come to is around patient-public involvement. So, there's loads and loads of brilliant innovations out there in the system. Fantastic tech, cutting-edge AI and things like that. But with some of the companies that we work with, what we see is that they either haven't been designed to meet the needs of the system, so the system hasn't been engaged in that development process. And secondly, the end user, which is often the patient, they also haven't been consulted in that design process. So you can have the best innovation in the world that's got a fantastic system benefit potentially, but if patients aren't going to engage with it and aren't going to use it, then actually its real world benefit is significantly less. So I wonder if I could come to Adele and Adam in the first instance, just to talk a little bit about the work you do in the PPIE space to make sure that innovations are developed in the right way. and then perhaps come back to you at the end, Steve, to talk about how you've kind of developed your product with the system and with patients and the public in mind. So over to you, Adele.
Hi, thanks, Sean. I mean, patient and public involvement, it's super important. And I think the key here, when you're looking at ensuring that solutions address health inequalities and meet the diverse needs of communities, is early engagement. You need to engage with people early, particularly those in underserved communities, to really understand the real world barriers to access and care. So first of all, use data to identify health inequality, demographics and population cohorts and hotspots, and then work with patients early to co-design with local stakeholders, including charities, faith groups, VCSE organisations, to really ensure that solutions are informed by that lived experience and tailored to those very diverse needs that different population cohorts have.
Lovely, thanks, Adele. Adam, anything from your kind of world and the insights you see working with both companies and particularly with patients? And I guess, that kind of openness that the patients and public, have towards engaging with companies and that appetite to contribute towards products and services.
Yeah, I think it's vitally important. It's important that patients feel empowered and they have kind of some contribution in how innovations are developed. They are the end user, if you like. They are the ultimate customer. In my time working on the MedTech funding mandate, just in some of the conversations already being had in that that we've touched on in the 3 years, quite a small window of time that I've worked in it with sizable innovators and companies, elements around what we've already discussed around sustainability, the change in understanding and the importance around all that. And he's exactly the same with the patient insight and how that is needed and vital, developing that solution to respond to a need. First, you need to understand the need, and assumptions creep in, and assumptions are really dangerous. And you only really understand the need by interacting and engaging these groups, like Adele's just alluded to. And then only then can you start building a solution that's fit for purpose. So that's in keeping with what we do, and what we facilitate, and it ensures that it puts in guarantees that solution will then continue to be developed in the same way. It's not a one-off activity. It's not just a case of engaging a group and going, I've ticked that box, I've done this, we've got what we need. It confirms that we're onto a good thing, or it allows us to kind of get over this next barrier. It's about how that you continue those relationships, you build relationship partnerships with these communities, with these individuals, to ensure that that's continued, and the innovation, that it remains fit for purpose, is producing those patient outcomes for the populations, and it can carry on, being amended and developed in the way that it needs to be going forward.
Lovely, thanks very much, Adam. And Steve, could come to you on that question next. And I think if you could just touch on the journey you've been on, I guess, and kind of what the key learnings have been along the way. So I'm sure people on the webinar today really appreciate those insights.
Yeah, and I answered this exact question yesterday on stage at London Tech Week with the head of MedTech from the Department of Health. So I'll kind of answer it in a slightly different way, but basically say the same thing. So there's a few different overlapping strands to answer this question. So one is that if you're developing a medical device, which many people in health tech do, you are obliged, the actual regulation, ISO 13485, actually obliges you to engage in extensive user research, customer, user, patient, clinician research before you even finish your design inputs. Okay, so that should happen. Now, does that always happen? I don't think so. I believe there's quite a high correlation with innovations that get spun out of universities by academics and that not happening, based in my experience of having interacted with quite a few of those companies, either through the HealthTech Hour or through the Last Friday Club. But for us, just to address that piece, we spent hundreds of hours speaking to patients, clinicians, GPs, any system person that we could get hold of before we even started work. So we had a concept of what the technology could do, but then we went really deep to understand everyone's views and experiences and problems and challenges and things like that. And so one thing, for example, that fell out of that before we even started actually developing it was that GPs would never be our customer, right? So they get lab testing for free, we discovered. And then we were like, oh, okay. Well, they're never going to buy our thing then, are they? So why would they buy our thing as a point of care test if they get lab testing for free? Now, subsequently, a few years later, as we've deployed out through systems, it turns out that there is a role for us in primary care, but we've gotten to that point by through experience. Now, a number of the innovators and innovations that I come across, their sort of number one customer group is like GPs, because that's everyone's experience of healthcare. And that's the easiest place to say that you're going to sell it to is a GP. But there's often a huge number of reasons why that just isn't feasible. So before you start, you need to be doing a huge amount of research. And sometimes that gets called PPIE in NHS language. But fundamentally, it's going out and talking to potential users, customers, of your product, so that you deeply understand the area that you will be deploying into and ultimately trying to monetize. So that's the one thing. And then during the way that we've developed, again, we rightly or wrongly thought about it almost like phase 0, phase 1, phase 2. So phase 0 is really just trying to find small groups of users, whether they're clinicians or patients or both, to use your technology, to then understand the experience of that technology, what the limitations were, so that you can continuously iterate on that. And that's how we've engaged with patients. And then phase 1 is a slightly larger group, where you've got something that you feel like is scalable. And then phase 2 for us is when we've been commissioned across multiple years in systems. So between that phase 0 and phase 1, we've been able to make huge volumes of amendments and adjustments to fit better with patient needs and also clinician needs, right? So it's definitely, but to Adam's point, the patients are the major group here. But actually, if clinicians aren't confident in your solution, or clinicians can't use your solution, it takes a huge amount of patient advocacy to overcome that. And I'm not sure actually that patient advocacy on its own would ever overcome a huge amount of clinician pushback. I'm not a historian of the NHS, so maybe there's been instances where that has happened. So yeah, I don't. The businesses and the founders that have come on the HealthTech Hour, or I've interacted with across these other platforms, even through the National Innovation Accelerator that I'm on and things like that, is there's a really big correlation between the businesses and founders that have invested in understanding patient needs really deeply, like as in going and sitting in car parks screening people themselves, which is what I did, or what we've all done. And there's different things for different businesses that mean that, but actually gone and speed of adoption. So I'll give you another example just as a counterpoint. One of the companies that I spoke to and was trying to help had a urine infection test machine that they wanted to sell to GPs. And I said, well, have you looked at the clinical pathway? And they were like, well, no. And I'm like, well, the clinical pathway means you don't need to necessarily do a UTI test anymore to prescribe antibiotics. And secondly, if a GP was going to do that, they would get that for free. So why would the GP buy your box? So it's not about the quality of the technology. It's about really understanding what the system will pay for, what the clinicians will use, and what will benefit patients.
Lovely. Thanks very much, folks. And just a reminder to everybody on the webinar, please do put your questions for the panel in the chat. Somebody has already put a question in, so it's a nice follow-on from what we were just talking about. So I think we'll just jump to that question if that's okay. So I think the point that they were trying to make is that it's quite easy often to engage with patients, carers, the public. You've got social media, you've got existing groups and existing infrastructure. but it's really, really hard often to engage with clinicians. And, whether that be frontline clinicians, service leads, people across the NHS, to get those insights of, actually, is what I'm doing the right thing? So I think I'll open that question up to the panel if anybody's got any thoughts and insights they'd like to share on that topic.
I think for me, it's about networks. We've been around 20 years, so we're very fortunate to have, we're in lots of different ecosystems. Obviously, the Health Innovation Network is a great platform to engage with clinical networks. There's other platforms that can be used. But, if you don't, in answer to Antoinette's question, if you obviously are struggling, there will be an ecosystem that you can tap into that will. It's just a case of accessing them, and maybe Sean, you could just mention the various organisations that are willing to help. PPIE, we've been around 20 years. PPIE is something that wasn't really around 20 years ago, and then it really started to amplify maybe 10 years ago. And there's a very good reason for that. If you're not talking to your patients, your participants, your clinicians, your surgeons from the outset, then you could, as I mentioned at the start, your technology or innovation could be biased by the user. So it's really important that you do engage from the outset with your intended user, not just ask them what's great about the innovation, because they're just going to say, yeah, we like it. You need to ask them, 10 things that's bad about it, and that way you can look for the points of weakness and fix them before it gets, potentially catastrophic further down the journey. So there's also a process of actually how you approach PPIE to get the right quality of information. And sometimes sometimes the answers might not be the ones that you want to hear, but more importantly, you need to act on it.
Yeah, I would just. Oh, Adele, do you want to jump in? Sorry.
No, go for it,
Thanks,
Steve.
Steve.
Sorry.
I'll just be super quick. So tap into us as a Health Innovation Network. We are well docked in with all parts of the system. We've got dedicated portfolios that span across clinical priorities. And then we've got our 3 innovation hubs, South Yorkshire, West Yorkshire, and we've got an innovation hub arrangement in Humber and North Yorkshire. We sit on various boards and meetings. So, it would be very unusual for us not to be able to get the attention of a clinician if you're struggling. And Adam can probably give a bit more insight, because that's his bread and butter. He is given a solution by the national NHS team, and he has to go out and engage with clinicians, sometimes that he's never had to engage with before. So, come to us and let us help you. Thanks for letting me jump in, Steve.
That's all right. And I'm not going to repeat anything that Rich and Adele said, other than to say completely agree. I'll add in just stuff that's incremental. So one, like shoe leather. I mean, it sounds basic, but for example, we all have a GP. We all know family members that have different GPs. Go talk to them. I mean, literally, like, just go and chat to them. And similarly approach people on LinkedIn, or if go to the conferences associated with your disease area. There are tons of free NHS webinars like this and free conferences. I'm not saying go to Health in Amsterdam and spend $2,000 on a ticket. Like, God bless if you want to do that. You don't have to. And we didn't, certainly when we started, but we would rock up at various things. Sometimes we sort of snuck in, sometimes we got on the list and things like that, but and we would hang around at the end of the talks of clinicians. The thing that we did universally across the board was we were super humble. I'm not a clinician by background, so I had no choice, and I was like, I'm really, really sorry, but we're trying to develop something to solve this problem. Could I just grab you for 2 minutes? I'd love to get the benefit of your insight and expertise. And by the way, I completely understand that you might think my idea is crap, and I'm fine with that. Just would love to ask you a couple of questions. And it's like, right, is there a problem here or not, do you think? 2, if a technology could solve it a bit like that, what do you think? 3, who else do you think I could talk to that might be useful? 4, if you thought this was useful and then I had a prototype, could I come back to you and you could muck around with my prototype? It's a bit of like shoe leather and trying to think outside the box a little bit on that. And then I'll just answer the next question for Matthew, because it's kind of connected on the supply chain and procurement bit. My take is like supply chain and procurement are probably not going to help you with product design and product finalization. So it depends a bit about what you're looking to do. So that those guys aren't really clinical in my experience, and they're not going to help you adapt your product to solve clinical or patient needs. So I'd be slightly questioning who told me to go and do some research with those groups. It's not a bad thing to talk to them, but it also depends on your life cycle. Like if you're not ready to go through procurement to be procured at scale, then talking to procurement is a total waste of time. Similarly, on supply chain, if you're not selling into hospitals, supply chain is really geared at the moment around secondary care, So I'm not sure what you're going to learn there that might feed into how your product actually works or solves clinical issues. But that's just me.
Thanks, guys. I think Lawrence, I know you were in technical difficulties, but good to see you back with us. Did you want to jump in with an answer to that question?
Yeah, I think just to add to what everyone else has said, I think, obviously clinical need is very important for any innovation coming into the NHS, and something we clearly look for as a funder alongside patient need and public involvement. I think a few resources out there. So we have an NHR industry team you can contact them. It's industry@nhr.ac.uk. They can help you find collaborators for your research going forward. Also, I mentioned earlier the HealthTech research centres, collaborations with academics and clinicians. Reach out to these people. There's lots of networks out there, and I think, as Richard said, Richard and Steve, you might find someone who's not interested, but I think you really need that clinical champion to see innovation get into the NHS. It's a tough way to get in, and you really need all the support you can get there. So I think I'd be surprised seeing a project come in without any sort of clinical collaborator or input into it at that point.
Can I make a comment after Antoinette, please, as well?
Yeah, absolutely. Go for it.
Do you want to go first, Antoinette? Sorry.
Hopefully that question.
I'm not sure she's allowed to talk.
Okay. So my comment when we work with particularly high growth startups is think of it as snowballs. So you have a seed of an idea, you probably a TRL3 proof of concept, and to have those, as Steve said, if you can get engagement with PPIE, clinician, patient, surgeon, who really likes the idea, then you can use that kind of as a motivation to get to the next step. So we've worked on projects where it's been initial conversations. We've ended up with an eye-for-eye PDA for just under £500,000 because we've gone through that iterative, very humble kind of process with our clients. And before you know it, you've got some key opinion leaders kind of backing your project with letters of support. And then that's kind of how it works. So don't look at it as a transaction. Try and bring them on the journey with you, and it will give it a lot of credibility.
Thanks,
let
Richard.
me just add one more thing before I forget. Sorry, Lawrence. The other area that people I think often overlook, where we had a huge amount of success in this phase 0 clinician engagement, is community pharmacy. And there are so many community pharmacists out there that have the ability to make independent decisions about their location to do things that is still under a clinical banner, and they're obviously NHS locations, and so it's almost sort of a grey zone, if you like. And they're again, there's community pharmacy. I don't mean walk into Boots, they're not going to do anything. Walk into an independent and start speaking to the pharmacist there if your innovation is relevant for pharmacy. Actually, we got a huge amount of traction that way. Not commercial traction, I mean in the clinician engagement space.
Lawrence?
Yeah, perhaps wrapping it all up, coming back to the supply chain and procurement question, I think, talking directly to those teams, perhaps not helpful at the early stage, but very much understanding how your innovation is going to be paid for, bought, who's it going to be used by, who's going to be making those funding decisions, what pathway it's going to fit into. I think that's definitely, again, something we look for. So it's not just an interesting, clever innovation that's going to fund to get to the next step. They need to be thinking, 2, 3, all the steps ahead of how this actually gets into the NHS. And that is, it's a long, complicated pathway. And often, if you don't understand that to start with, you can find yourself doing all the wrong things before you realise your mistakes. So it's definitely worthwhile thinking the whole process through. And again, coming through our funding program now, it's very competitive. People who don't have an idea of how their innovations are ultimately going to be used in NHS are going to be less competitive. Thanks.
Lovely, thanks, guys. And Antoinette, I know you had your hand up earlier. Lottie, I'm not sure if we can unmute Antoinette if she wants to jump in with a question at all. Hopefully what we've talked about has at least partly answered that question.
You should have the option to unmute, so fingers crossed the technology works. Hi, thanks. Yeah. To be honest, yeah, for the most part, my question's been answered. But I wanted to speak to Steve's point that I've actually also already engaged with West Yorkshire HIN, and I've not found that helpful. So I'm wondering what's the best way to go about re-engaging, because my innovation, I did receive some funding to test it out, and I tried to engage with clinicians from the outset, and I found more engagement with end users. That definitely changed my focus. This new focus would actually need more clinician engagement, but that is the part that I do struggle with.
Antoinette, in your question there, you were just saying you'd engage with the West Yorkshire HIN.
Yeah.
Is that ourselves as Health Innovation Yorkshire and Humber, or is that part of the West Yorkshire Integrated Care Board you're referring to?
No, it's yourselves. Yeah.
Right. Okay. Right. Fab. I'll come back to that in a second if that's okay. But Steve, do you want to jump in?
Yeah, look, I obviously what area is your innovation in? Do we know?
Yeah, it's bladder care.
Okay. Is it a medical device or not?
Yeah, so it's it was initially the focus initially was a medical device, but as I say, just through engaging with users, the focus shifted to more of a digital service that would be more of benefit. Yeah.
Cool. Obviously, I don't know what did or didn't happen between you and West Yorkshire. I'll leave the West Yorkshire guys to deal with that wonderful question. The take I would say is like, it's hard. I mean, it's hard getting attention from anybody about anything, not just in the NHS, but anywhere. So I don't know how many times you tried, and I don't know how you tried, and I don't know how you positioned it, but that's often part of the battle, which is if what you're doing is aligned with one of the health innovation networks are very good at publishing about what they care about. That's one of the big things that they do really publicly. So if you can align what you're doing with something that they care about, then that's going to improve the hit rate, I guess, of your responses. But there are 15 of them, it's not, you don't, so if I mean, we parallel processed all 15 of them all the time. Some went slower sometimes, some sped up. Then, it's only 15 organizations, which in B2B sales, which I've sort of got in previous ventures a huge amount of experience in, 15 accounts is nothing. Like if you're running a business and growing a business, being able to interact and chase 15 different entities should be achievable. So it's you can't just rely on one HIN, because they've got their own priorities and they've got their own workflows, and they're also under-resourced and understaffed and trying to do 1,000 different things all the time. So just because I also would also say, just because they don't respond, it doesn't mean that you're not right. Right? Don't take it so that that it's some sort of statement that what you're doing isn't of interest. Part of the battle as an innovator and as running a business is to make sure people pay attention to you, which is really hard. I don't know if that's helpful, but that's my only comment on that.
Thanks, Steve. I mean, you've took a lot of the words out of my mouth of what I was going to say. Antoinette, I'm just going to drop my email address in the chat. If you drop me an email, we'll pick that conversation up offline. I mean, as Steve said, there's a huge possibility that when you previously engaged with us and we've passed that on to the clinical teams across the region, it perhaps just wasn't the right time for them. There was other priorities, there was other needs, other challenges, and that right at that particular moment, it just didn't land well with the system. As you just said there, Steve, that doesn't mean that the innovation itself is flawed, and it doesn't mean that now isn't the right time. So if you just reach out to me by email, we'll pick that conversation up. We'll very quickly explore whether it is something of interest, not just to West Yorkshire, but to the whole Yorkshire and Humber footprint. And if it's not, we'll pass you over to some of the other health innovation networks nationally to see actually is it of some interest to them, and it might actually align better to their footprints.
And again, I would emphasize, think about community pharmacy. I suspect people who have bladder issues will be going to community pharmacy early in that journey, as well as trying to seek help from their GP, but they will also be interacting with community pharmacy to seek solutions. So even if they might not be ready to buy it, they might be a good group to go and interact with to say, could you just tell me how you could do some research? How many people come in with data issues? What kind of issues do they have? What kind of help would you like to give? What are you prevented from giving them because you don't have the tools or technology to do that? You might get unhelpful answers that might be bad, or you might get some helpful ones. So it doesn't have to always go through the HIN to go to the system. There's other ways to access healthcare customers, I guess is what I'm saying.
Thanks, Steve. I mean, we've got about 5 minutes left of our webinar today, so I'm just going to start to wrap up some of the conversations.
Can I quickly chip in? Sorry
about
that.
Adam.
I'll only be a minute. I can't raise my hand on the thing for some reason. As Adele alluded to, engaging clinical teams is like my bread and butter. It's the day-to-day. It is incredibly hard, as Steve has also mentioned. Many of emails that even myself send out that are left unanswered, and you have to kind of persevere with it. I think working quite closely with the clinical teams, we always have to understand and be flexible that they're under the pressures that they're under. I do not know how consultants, nurses and staff find the time to look at anything new above what they do with the day-to-day. It truly is amazing. And I think half the battle is finding that motivated, really driven, clinical clinician that's within these groups that are really that are really motivated to try something new. It's not just a case, even with MedTech funding mandate, it's gone through NICE approval. We've got a series of recommendations. Those recommendations and evidence and benefits are interpreted differently by all those different groups within the healthcare system, whether you're a clinician, whether you're in finance, whether you're a patient. It means something different, and you have to kind of repurpose that information that speaks to them. What's going to grab them with a clinical team? What's, a clinician, what's grabbing me to be interested in this? And it's a bit of an art, it's a bit of a skill, 100%. So just getting that attention and that motivation to be involved in it is a massive achievement. Even with MedTech policy, something that's NHS England driven, it's a huge stakeholder engagement piece. I manage relationships. That's how I describe my job. We have different outputs around it all, but it's about managing relationships and tapping into the psychology that's going to want someone to come on that journey with you. In regards to your situation and your experience, Antoinette, I'm linked really closely with urology area networks in our region, so I'll put my email address on as well, because I think it'd be good for us to have a chat, because I can basically goes direct to urology consultants if that's appropriate to try and link you in that way. Right, cheers, Sean.
No, thanks, Adam. Sounds like a really, really solid offer of support there.
Can I just jump in quickly with one tiny bit of thing that should hopefully motivate people? So
yeah, 30 seconds, Steve.
30 seconds, you got it. I can do this. Probably 27 seconds now. So the first ever HIN that we went to was Northwest Coast, right? Indy Singh, Phil Jennings up there. I was in there before we even had a product. It was on paper. They helped us. They spent time with us. Have we ever gotten any money or any connection to the local system from those guys? No, we haven't. But I've been talking to them for 5 years. But they're great, and they help connect me with other people in other systems where there was something to move forward with. So just because it doesn't go forward in that system, it doesn't mean it's not worthwhile investing in those relationships.
Lovely, fantastic point to end on there. So, I mean, I'd love to continue this conversation and explore lots of the topics we've touched on in loads more detail. Richard, I'd love to delve into the product development, sustainability bits and a bit more. Lauren, some more of the funding side. But fortunately, we've just not got time today. So I think all that remains for me to say is huge thank you for everybody who's joined today. I hope you found it useful and insightful. And equally, huge thank you to our fantastic panel today for all their insights and expertise. I know the panel has shared contact details, insights and bits and pieces in the chat. So please do connect with the panel, with myself. Connect with us on LinkedIn by email. The support and advice is out there. Use the Health Innovation Network as that point of contact. We might not be the right people to help you, but what we are is a fantastic front door to getting you to the right people. And we're not just going to throw you off into the ether. We will very much manage those relationships and make sure you end up connected to the right person to get the support and the access that you need. So huge thank you, everybody, and goodbye from me.